So hello everyone, this is Dr. Nikhil Agarwal. I have done my MD from King George Medical University, Lucknow, and I will be taking care of your anatomy sessions. And to begin with, as you know, the first class of anything is introduction. So to introduce you to this subject and also the various anatomical terms which you should be knowing about. Okay, so we will dive in and I will be using a lot of 3D animations using this rotation. Here you can see the entire skeleton. Okay, we have a lot of things to discuss in this. The entire human body, it's very interesting. Anatomy is the things. Let us add some more things. You can see if I add the connective tissue here, then if I add the muscular system, and so on and on, we can see I have all the systems below which I can add: the arterial system, venous system, lymphatics, the nerves, respiratory. If I just remove the muscles, you can have a better look. The connective tissue, you can see there are so many things to study in anatomy. Then we add the digestive system, which you have read in your 11th 12th biology also, endocrine and urogenital. Then if I add the integumentary, that will be the skin. So you can appreciate the various things here. So we have the male and the female models separate, and we will discuss each of these structures in quite detail, okay, as per the curriculum. And we will be following the NMC competency based education system, where we will be following the basic competencies which you will see in your all the anatomy textbooks. In the initial beginning of each chapter, you will find the NMC competencies, and my classes will also revolve around the same. So having understood this basic thing, what we are going to do, let us dive into the subject. So first, to introduce you, so this human anatomy, it is a branch that deals with the study of structure and organization of human body. Okay, and you might have heard the word cadaver. So let me tell you, I will be writing the keywords on each of the slides so that you have everything with you. The cadaver. What is a cadaver? A deceased body of a human being that is used for educational, medical or scientific purposes, and it is preserved using the formalin solution, which you will get to know in your medical colleges. Then if I break up the word anatomy, the term, it is derived from the Greek word anatome, from the Greek word anatome. Okay, so in this, if I further dissect the word, there will be two words, that is ana, that means through, and tome, that means to dissect. Okay, and this was coined by Aristotle approximately 2300 years back. And then you might have heard of the word, that is the dissection, which you will be carrying out in your medical colleges. That is the process of carefully cutting and separating the various structures of the human body, and to study the anatomical structures and the organization basically. Okay, so with this understanding, let us go into the subdivisions of anatomy, which you will be dealing with. So anatomy can be divided into various types, okay, based on the method of study. So first and foremost, that is the gross anatomy. Okay, so what is this gross anatomy? You will be hearing this word again and again in your classes. This gross anatomy is nothing but cadaveric or topographical anatomy. It is again the study of human cadavers by dissection, and it can be further classified into two types. Okay, now what are these two types? Number one, the regional anatomy, and trust me, the whole year you will see in the anatomy subject, this is the method to study the anatomy as a whole. The gross anatomy will be taught to you in all your colleges pan India, and abroad in the form of regional anatomy. Okay, that is the study of human body in various parts. And for example, how many parts you can see here? There are total 6 parts. Okay, so there are total 6 extremities. The word is used, extremities. Okay, so what are these 6 regions or extremities? Number 1, that is the head and neck. Okay, you can imagine what is this region, and the same you can see on the image also on the right side. And the brain, that is, brain will also be known as the neuroanatomy. Neuroanatomy. You will study all of these things separately in detail. Okay, then you will have the thorax, abdomen and pelvis region, and then the limbs, the upper limbs and the lower limbs. Okay, so this is the gross I would say division of the entire human body into 6 regions. Okay, and then you can also divide this into another form, that is a systemic anatomy. Okay, and this approach is actually followed in the international standards. In the outside India, you will see the education system focuses more on the systemic anatomy in this region wise approach. Okay, so this is useful in the sense you will be studying the physiology subject along with anatomy, you know that, and that will be taught to you in the form of systems. Like you will be studying cardiovascular system, the muscular system, okay, the nervous system, and that same approach will be followed in the final year of your MBBS, that is in the medicine prof. Again, you will use a systemic approach, and that makes much more sense to you in terms of when you are studying everything together. But if you are studying the regions of body separately in detail, then it makes much more sense to you when you do the regional anatomy. And that's why the curriculum of anatomy deals around these 6 extremities all throughout the year. And you will have various tests, assignments, exams, small tests, seminars also on these 6 separate regions, which may span from 1 month to 1.5 months. Some will take more time, they will take 2 months in your curriculum of anatomy. So you will get to know that. And if you talk about the systemic anatomy, here you can see there a region wise approach that includes the integumentary system that revolves around the skin, and then you have the skeletal system, which I showed you in 3D also, that is the bones. Okay, and then arthrology, the study of joints. You can imagine the bones and the joints are separate MS branch, that is the orthopedics, you might have heard of. Okay, so that is another different thing which you will read in detail. Okay, the bones will be held by your hand, and you will be describing the surfaces, borders and relations, and many nerves which are related to it, the muscle attachments. You will read ligaments, so many things, and the joints which are formed by each of the bones. Okay, and then you will be studying about each of them in detail, and there will be long question, short question based on those bones, the parts and the joints. Joints can be long questions, like the shoulder joint is a very important joint, TMJ, the temporomandibular joint, and similarly there are so many important joints which have come as long questions in your exams. So those will be taught to you in more detail. The muscular system, as you can imagine, all the muscles of the body which you will be studying in detail. Then the nervous system, cardiovascular system. In the muscular system, there is the skeletal muscle, cardiac muscle, smooth muscles, the major muscles of the body, okay, which you will read eventually. And then you have the cardiovascular system revolving around the heart and the vessels, important vessels. Lymphatics, okay, there is a separate channel which is the lymphatic system, which we will take up separately in a class, and you will understand what it deals about. And then the endocrine system, you saw in the 3D animation in the beginning itself, I clicked on the button and the entire endocrine organs of the body, like the thyroid gland, okay, these all showed up in the 3D animations, and that will be taken again in the region wise. Like for example, thyroid is in the neck region, so we will be teaching you there in the head and neck region. Okay, that comes as a part of that. So digestive system, you know already from your the 11th-12th classes. Respiratory system, okay, that is regarding your lungs. Digestive system regarding your stomach, intestines, okay, all those parts. The reproductive system, the genitals, okay, and it varies in the males and females. Then you have the urinary system, deals around the kidney, ureters, okay, the bladder, all those things which you will study in detail. So that is systemic anatomy. So I hope by now you have understood how we are dividing the entire anatomy in two forms. Okay, so one was gross and one was regional anatomy and one was systemic anatomy. So this was the two parts of the gross anatomy. Now understand, this is gross anatomy. Next, if you move on, there will be another category which I am highlighting in the similar manner, that is microscopic anatomy. Now microscopic anatomy is again something which will eat your head all around the ear, and also in your exams you will be tested in your spotting. There will be spotting exams. You will be given 1 minute in your medical colleges. You have to make the identification of the histology slide. So we are studying the structures of the human body using the microscope. I think that also you have had an exposure in your 11th 12th, right? So this is the microscopic anatomy or histology, and you will get various questions in the exam to draw the sections on histology sections. So that will be also known as microanatomy. Okay, so please remember this keyword, because you will find many questions in your 10-year papers of your university records where you will find, suppose for example, thyroid gland. So microanatomy of thyroid gland will be coming as a 5 marks question. So you have to draw the section. So you should understand what is microanatomy. We are meaning the microanatomy means the histology. We are not asking you the gross. Okay, so there you should be paying attention. Then there is a separate viva for you in the surface anatomy. So that means the study of the relationships of the deeper structures of the body. For example, you know, you might have been knowing or you have felt fever or something in your life till now. You have gone to a doctor and he holds your hand and keeps a check on this pulsation. Okay, so this is the radial artery pulsation, that is the pulse. Okay, so you might have seen in movies, web series, maybe various places. So this is something which you do. So without knowing the surface anatomy, you cannot keep your hand exact position on the radial artery, because otherwise you won't be able to find the pulsation. Similarly, there are multiple places where you find the pulsations of the body. That also will teach you. So this was just an example. Then you have the living anatomy. And surface anatomy is something again which I mark as a question. It will be asked to you separately as a viva, which is given marks also. It has internal assessment marks and you will be tested for this surface anatomy. So wherever you are taught surface anatomy, go in detail regarding the same. Then you talk about the living anatomy. Now living anatomy is study by the inspection, palpation, percussion and auscultation. So this is the classical examination technique which you will hear in physiology as well as medicine, surgery. So these are the 4 pillars, I would say, of the clinical practice: the inspection, palpation, percussion and auscultation. Okay, inspection means we are just seeing the thing. Palpation means we are touching the thing. Percussion means we are tapping and seeing the sounds which are coming out of it. Okay, then auscultation, we are using a stethoscope. So what we are dealing with, which we can do the living anatomy, we can test with the help of various instruments like the bronchoscope, which will go inside the bronchus, you know the words, which are going inside the lungs. Gastroscope or endoscope, which is going inside to check the GI system, gastrointestinal system. Cystoscope, that is being introduced into the urinary bladder. Okay, and there are various imaging techniques which we will talk about region by region. Then we have the clinical or the applied anatomy, and mark it very, very important, because this is something which I personally enjoy teaching you, and also I wish all of you throughout the year, whatever books you read, okay, be it foreign authors, Indian authors, please make it a point to remember the clinical or applied anatomy. You will see many textbooks have the name changed, clinical anatomy. Okay, so you will, this is very important. And entire clinical practice, being an MBBS doctor, even if you do MD or not, you are a doctor once you complete your MBBS. And as a doctor, as a practicing physician, when you get yourself registered with the medical council, applied anatomy is something which will take you throughout your life. If you know the applied region, if you know the applied, that is the clinical anatomy, the relevance of that anatomical fact, then you can utilize it in the clinical practice which you will be dealing with. Okay, so if you don't know that, so it's better to at least read throughout the year. Even if you don't remember, that's not a problem, you just read at least. Okay, give a single reading of every clinical box in the textbooks, because throughout that only you will be able to at least know something in the MBBS first year. So you need to apply your anatomical knowledge for diagnosing and treating the various diseases and surgeries. Then we have the radiological anatomy. Again, there will be a separate viva for the radiological anatomy, which will be taken in the assessment part. That will be the study of bones and other structures using radiography like X-rays, MRI, CT scan. Although we don't teach you in detail regarding the MRI and CT, that is a part of your other professional examinations. But yes, in my classes, I will teach you some of the basic MRI scans, CT scans, along with the regions where I will take the X-rays. Because nowadays, if you appear for the next exam, in the entrance exam also, any exam, they are testing your knowledge based on simple anatomy knowledge based on MRI and CT scans. So ultrasound, X-ray, CT scan, MRI, these are the four main radiological modalities which you should, as an MBBS first year student, you should be knowing about. Okay, I'm not saying you to be able to treat the disease, but at least you should be able to identify the normal variation from the normal anatomy. That is important. So that involves the CT scan, ultrasound, X-rays and the MRI. Okay, then we go on in the list, that is the experimental anatomy. That is something which you just need to know about. Just that is a study of various factors which determine the form, structure and function of the different parts of the body. Another thing which you should be knowing, I'm not highlighting that one, which is not important, but you should be knowing, awareness is important. Okay, I will be taking up a separate class on how to master anatomy, so you will be able to understand these simple things like must know and good to know stuff, which is important to differentiate. So this is another thing which you need to remember, that is the embryology part, and this will be again taught to you in detail. Okay, that is a developmental anatomy, how the things are developing inside the individual via the embryological stages. Okay, now like how it was formed in the fetus, okay, during the pregnancy, in the intrauterine life, how the organs were formed. Okay, and what are the various congenital anomalies which can happen. Okay, including the genetics. So that also will be taken in detail. So this is also having some marks in your assessment. In your MCQs also you will get the questions. In your short notes, long notes, you will get a lot of questions on this. Then as I told you, genetics you have been studying from 11th 12th also. Okay, that will be, you will building upon that concepts only. That is a study of the heredity and the variations based on genes, DNA and chromosomes. Okay, there are various syndromes which you will hear about, so you should be knowing. Then there is something known as comparative anatomy. What is this comparative anatomy? This is a study of changes in the form, structure and function between the animals and the humans. So in your medical college, I don't know, but in KGMC I did have an opportunity to see the comparative anatomy in the museum. There was the skeletons of the horse, the skeletons of the various animals, okay, the lower vertebrates, they were all kept in the museum, and there was a skeleton of the human being which was kept side by side. So you can have a good comparison how the different bones are present in the body of the humans versus the various animals. Okay, so you can have an understanding, and it's very interesting to understand that the things which you will read all throughout the year, that is quite different in animals. Okay, and that is for different functions. Then you have something known as the physical anthropology. Okay, again I'm not highlighting, so I hope by now you understand the things which are highlighted and written Q. That is the most important for a Viva theory exams and throughout your life. Rest everything you should read, have a knowledge, become a knowledgeable person, but that is not going to be tested and not going to be useful. So that will be the pattern which I will be following. So physical anthropology, that is a study of external features and measurements of different races and groups of people. Where will this become important? Where you will study about the different groups of people. For example, if you are doing a research study where you are doing some experiments in maybe you are testing some values and you are seeing between the different races or ethnic groups of people. Region wise study if you are doing, that is done, and you will do it as a part of your MD after MBBS as a thesis, or if you are very proactive, you can do intramural research projects along with your faculty in your first year MBBS also. So that is supported by ICMR. There are many grants which are available, so you can utilize this physical anthropology knowledge there. And also it will become important in forensic medicine, that is again a subject of the next year. Okay, so then after understanding all these subdivisions of anatomy, I come on to the topic that is a history of anatomy. So the history of anatomy is again very interesting, and this history has again a lot of MCQs which are framed from this topic. Okay, so you should be knowing about this as very important, which I will again highlight. Number one, the Hippocrates. Okay, Hippocrates is something, the name which you can never forget, because after you complete your MBBS you take a Hippocratic oath also. Okay, so you will remember him forever, and you will be taking an oath that you will not do any harm to any person after you clear your MBBS and start practicing. Even if you are put under pressure, you will not do any harm. Okay, so he is the father of medicine. Okay, so that is again an MCQ which has been asked multiple times. You will see in the various Q banks. It's a very famous MCQ. Okay, then there is the name which again important, that is the Herophilus. You can skip the years, the BC, they are not going to ask you, but just the name and father of all these fathers. Okay, so he is the Herophilus, which is the known as the father of anatomy. Okay, he is a teacher of anatomy in Egypt and known as a teacher of anatomy in Egypt, and he did the first dissection of the human body. So he is known as the father of anatomy. Okay, so don't forget this name, again very important. He is hero. Okay, remember, hero is father of anatomy. Then we have a modern one. Okay, so founder of the modern anatomy, he is the Leonardo da Vinci. I think you have heard this name also previously. He was an Italian artist and anatomist. Anatomists by default are artists also. You have to draw diagrams. Otherwise, without diagrams, anatomy is like very dry subject and you won't be getting marks. I hope you have heard of the name Mona Lisa, famous painting that was from Leonardo da Vinci, and he is the founder of modern anatomy. Then the name, that is the Andreas Vesalius. He is known as the reformer of anatomy, also the father of modern anatomy. See, the founder of modern anatomy is Leonardo and the father is Andreas Vesalius. So there is a difference. Okay, and also very famous book which you will get to see. I got to see this textbook, the hard copy of this textbook in the museum again. So you may be able to see this on internet. You can fetch this, you will Google this, you will get a lot of images. That is a De Humani Corporis Fabrica. Okay, De Humani Corporis Fabrica. So this is the human body diagrams, as very beautiful diagrams which you will see. Okay, which of that time, it is so close to the natural anatomy which you study today. So you should be knowing these names. Again, these are asked in your MCQs. Okay, these are all MCQs, founders, fathers. Okay. Then again another name in the picture, that is William Harvey. Now William Harvey is again a very interesting name. You might have maybe heard of his name also. He was the one who gave the functional orientation of, which is known as anatomy and blood circulation. So even if you don't remember functional orientation of anatomy, just remember the key word here, that is the blood circulation. So link the name of Harvey with blood circulation. Again, this has been asked in your MCQs. Okay. Then Antony van Leeuwenhoek. I think this name is also heard in your 11th, 12th. Okay. He was the one who discovered the microscope and helped to develop the histology, that is the microanatomy I told you. So he discovered the microscope, again very important name, you cannot skip his name again. Then Marcello Malpighi, okay, he was also known as the father of histology, okay, he is known as the father of histology. Again, this is not too much asked multiple times, but yes, you should be aware, fathers के list में it is important. Then William Hunter, so पहले था William Harvey, now this is William Hunter. Hunter, he gave the modern embalming techniques. So the body which you are going to dissect in your medical colleges, that undergoes a process that is known as embalming, that is a preservation method. So modern embalming techniques were given by this, okay. Then John Hunter, so there are another Hunter. Now this Hunter you will study in detail in the exam. When I will talk about the lower limb region, you will study the John Hunter, who was a famous surgeon, and he discovered the Hunter's canal, that is the adductor's canal, okay. So this we will take up in detail, the boundaries, contents and everything. That is a part of your short notes in the lower limb, okay. Then another name in picture, that is the von Roentgen, okay, Roentgen. He was the one who discovered the X-rays. So please remember this name also will link to X-rays, and it has been tested in the exams. X-rays के साथ link है, von Roentgen, okay. Then Gregor Mendel, I think again his name is quite famous, you might be recalling Gregor Mendel. You might have heard in the institutes also, Akash Institute, or maybe you have joined some coaching in 11th 12th, you might have done these names. He was known as the father of genetics, okay. Then there is the name that is Camillo Golgi and Cianto Kajal or Kajal, okay. He got the Nobel Prize for the work on nervous system, okay. Then the Ernst Rusk and Max Knoll, they developed the electron microscopy. Again, just know them, not too much important. If you have heard, if there is an MCQ, maybe you can take the answer, okay, because you have to prepare yourself for the next exam. Then James Watson and Crick, this is a very famous model, again you might have heard the name itself, James Watson and Crick model, that was the 3D structure of DNA, okay. So this is again a very famous name and important one. In electron microscope, that is the Max Knoll and Ernst Rusk, okay. So these are few names which you should be able to recall if there is an MCQ. So done with the history part, the introduction part. So now I can dive into the main part, that is the anatomical terminologies. But before I go into this anatomical terminologies, I need you to understand some things. So there are some interesting facts, like the largest region of the human body, that is the abdomen, okay. The largest region is the abdomen. Let me write that. Now you know these terms, abdomen, what we are talking about, okay. And largest bony cavity, I am not writing of human, that we are talking about human being only, okay. We are not a veterinary doctor, we are going to be practicing allopathic doctors, we will study only human body, okay. So largest bony cavity, that is the cranial cavity, okay. You study all these things in detail, okay. Then longest bony canal of the body, okay, that is the vertebral canal, that is the vertebral canal, okay. Then the hardest tissue, I think you might have heard of this name, hardest tissue of the body, that is enamel of the tooth, okay. And so this is something which you should be, these are all interesting facts, okay. And heart is the first organ of the body that starts to function, the first organ to start functioning, that is the heart, okay. So these are These are the list of some interesting facts. Okay. Next we come on to the most important part, that is the anatomical position. So this is something which will be asked in your viva in the first classes, first few classes you will be taught about this, and you will be asked about this in the exams. So this is very important for viva, please remember, and also for any viva, not only in the first general anatomy viva, in the entire regions you will be asked about this. Okay. So there is something which is important, because so why do we need an anatomical position? Just imagine you will be grinded all throughout the year for any bone. What is the anatomical position of radius, ulna, humerus, so many bones in the body, you will be holding them in classical anatomical position, and then the viva will begin. So the thing is that why it is important, because what may be the different regions which we will discuss, the medial, lateral, we will talk about so many words. So there has to be something very standard, okay, which is followed globally. And when I am talking about the left side or right side of any bone, so it should be very classically the fixed position which everyone imagines in the in a mind, and then you talk about. So this is the classical anatomical position. Now in definition it has certain features which you should be knowing. So number one is this, that is the body is erect. The first thing, okay, the body is erect, you are standing erect. Then the eyes are directed forwards and looking straight. Okay, so that is another point which you have to tell. Number 3, this is first point, this is second point. Third point, the upper limbs, they are hanging by the side of the body. Okay, the upper limbs, they are hanging by the side of the body, and that is another thing which you have to do. Okay, the third thing, then fourth thing is the palms should be facing forwards and the fingers should be pointing straight downwards. Okay, so this is number 5. The number 6, the lower limbs are parallel to each other and with the feet flat and close together. Number 7, and toes pointing forwards. Okay, so these are few things which are important, okay, which you should be knowing. And as I mentioned, the need for the anatomical position is, this is for your own understanding and viva point of view. In the medical field, all these body structures are described in anatomical position, and this is very essential because to maintain a standardization of all the descriptions irrespective of the position of the patient, specimen, place, time, anything, a very precision, and to avoid any confusion, because all the textbooks are mentioning certain descriptions, so it should be very precise and clear to you when you are reading the textbook. So we are talking about everything from the anatomical position point of view. Then clinical assessment and surgical planning using the surface anatomy, that will also be useful when you are talking about the anatomical position. The radiological imaging and its comparison with the living anatomy, now I can use the words, right? So now you should be able to understand. Another thing, communication with the patient. Okay, so that will also involve around the anatomical position, how you can explain the disease which has happened, maybe some growth has happened, maybe some fracture has happened, how will you explain what part of the bone has broken. So you should be knowing the normal anatomical position of that bone, so that you can try to understand and explain to the patient how this is abnormal. Okay, so that is about the anatomical position. Next, let us know about the various positions of the body. So number 1 is the supine position. Now supine position, the person is lying, as you can see in the image, on the back and arms by the side. The palms are facing upwards and the feet are put together. Okay, so these are few points which you should be knowing, and you will be again getting the surface anatomy in the classes as supine cadaver and prone cadaver position, where you will be dissecting the in front of the body, back of the body. Then the prone position, that is the person lying on their belly with the face and the chest abdomen facing downwards, okay, as you can see in this image. Now don't be going regarding the palm position. In many textbooks it's given palm is facing upwards, in many is given palm facing downwards. Don't worry about these things, that is not going to be asked in your exams. Just in the supine position the palms are facing upwards, that is one thing which you should be remembering, okay. Don't focus on the palms in the prone position, okay. Then we talk about the lithotomy position. This is classically very important position again. I hope you can see the image and understand where it may be used. So the person is lying on the back with the legs up and feet which are supported in the stirrups. So this is the kind of stirrup which you can see on the table. The hip and the knees, they are semi-flexed, and the thighs, they are abducted. I will tell you these terminologies: abduction, adduction, all these things. Now this position is classically used for the normal vaginal delivery, okay. So this is something which is asked to you in the exams. It is used for the normal vaginal delivery of the baby and for various surgeries involving around this region and examination procedures, perineal examination, various purposes, okay, which you will understand eventually throughout the course of the anatomy. Then the right lateral recumbent position, okay, and the left lateral recumbent position. You can see you might be doing your rest in the bed with these positions, okay. You will be lying down sleeping on the bed in these positions, so you know these positions very well. That's why pictorial memory is something which I focus more upon. So there is something known as fundamental position. So that is similar to the anatomical position except the palm which is facing the body, okay. And then right and left lateral recumbent position, in which the person is lying on the right or the left side with the right or the left side of the body touching the surface, okay. So as you can see, another position as you can see in this image, that is a Trendelenburg position. Now Trendelenburg sign will also be taught to you, okay. That is different, this is position, so don't confuse between these two terms, it will be taught to you eventually. But in this Trendelenburg position, what happens? The person is lying supine with the feet higher than the head by 15 to 30 degrees, okay. This position helps the blood flow to the brain in cases of hypotension and shock, okay. So it increases this helps to increase the blood flow to the brain, okay, in case of hypotension and shock, okay. Now this is used for, classically used for laparoscopic surgeries of the lower abdomen and pelvis. But what else it can be used for, you might be experiencing, I don't want you to experience, but maybe it happens when you go into the first year, when you do the dissections in the first or second day, when you go around the cadaver, that anxiety and stress may cause you to get fainted in the DH hall, the dissection hall. And then what you will do, the other people around you, what they will do, they will put you in this Trendelenburg position where they will raise the legs so that the blood flow to the brain can increase and you will be again conscious, okay. Otherwise you will just get unconscious. So that is something which is useful again in emergency. So this is something Trendelenburg sign position which you will be remembering through this. Another position is known as the Fowler's position, okay. What is this? In this, as you can see, you might have seen in various web series, pictures, movies, patient is kept on the ICU bed or maybe some bed after recovery in Fowler's position. What is this? The person is sitting straight up or leaning slightly backwards, and this is a very resting kind of position. You might also be doing casually when you are on your mobile phones. So this position helps in improving the breathing in non-ambulatory patients and also increases the comfort during eating. So classically post-operatively the patients are kept in this position, and when they are eating and it will improve the breathing, it will take care of the gastric upset if there is any, and it will be very important in those patients. Then another position, that is a Sims position. What is this? In this, a person is lying on his or her left side with the left hip and lower limb, as you can see here, straight, and right hip and knee is semi flexed. Again, this is a very resting position which you might be using while sleeping, but this is classically used where this position is used for rectal examination. Okay, this is Sims position. So this you will again read eventually in the surgery prof, and you will read about all the things. Then we talk about another important aspect of the, again, introduction only, that is the anatomical planes of the body. Now classically these planes are used for description of structural arrangements of the human body and relationship of the various structures. Then what are these planes? And these are often tested in the exams as MCQs as well as image based questions. Okay, and also viva, and also everywhere in the body where you will study the sections, that planes will come important, especially in the neuroanatomy, the brain, you will study the sections of the brain in various forms, that will be important. So what are these different planes? Let us see. One is the median, or also known as mid sagittal plane. Okay, so this is, it is the plane which passes through the center of the body. So just imagine, if it is passing through the center of the body, it will divide the body into the equal right and left half, correct? Then there is something known as sagittal plane. Okay, again, that is any plane parallel to the median plane or the mid sagittal plane, that is the sagittal plane. So it can be parasagittal plane. Okay, so that is close to the midline or maybe away from the midline. Okay, then there is another plane, that is the coronal, also known as frontal plane. This is passing longitudinally at right angle to the sagittal. So sagittal aise tha, this was sagittal plane, so coronal will be in this manner. Okay, so it will be a coronal plane cutting the body into two halves. Now which two halves? That is anterior and posterior half. Okay, so any region of the body, if you cut in this manner, suppose a wall in front of you, it is cutting and passing throughout your body, so it is making the body into two parts, the anterior, the aage wala, ventral or the anterior part, posterior, okay, dorsal or the posterior portion of the body. Okay, another plane, that is the transverse or the horizontal section in this manner, which is a cross sectional plane passing parallel to the horizon and divides the body into upper and lower half. As you can see, we have cut this here, so upper half and lower half, that is the transverse or the horizontal. This is right part, left part, that is the median or the mid sagittal. Parasagittal or sagittal plane, that is again cutting the body into right and left, but it is not from the midline, away from the midline. Then you are cutting through this plane, that is the coronal plane or the frontal plane, which is dividing the body into anterior and posterior halves. Okay, another plane which is not shown in this image, there is another plane, that is oblique plane. Okay, this you will hear more importantly in the x-rays. Okay, that is any plane other than coronal, transverse, sagittal, mid sagittal is the oblique plane. Okay, so that is another plane. So I hope it is clear to you, the planes. Next we come on to the anatomical terms. Now in this anatomical terms, you have various important terms. Number one, that is the anterior. Anterior means towards the front of the body. Posterior, towards the back of the body. Superior, that is towards the head. Inferior, that is towards the feet. Okay, so these are very important terms. Then there is a word, that is the medial and lateral. Okay, and proximal and distal will come back again. Then this is in the midline, which you know, this is the midline of the body. So this is the medial word, medial and lateral. So what is this? Medial means towards the median plane of the body. Lateral means away from the median plane of the body. Simple. What is median? Median is in the median plane or in between the two structures, that is median. Then there is a word, that is superficial. Okay, so there is the word, okay, inferomedial, inferolateral, these are all the different parts, okay, like the medial border, lateral border, okay. Again, we are putting this in the anatomical position, then we are talking about, okay. In this, what was left, the proximal and distal, we will come back, dorsal and plantar, okay. Look at this image. This shows another two terminologies, that is a superficial and deep. Superficial would mean that is the towards the surface of the body, towards the surface of the body, skin. Deep would be away from the surface of the body or the skin, within the body, that is deeper aspect, okay. So internal organs, they are deep. Skin, the outer surface which I am touching, that is superficial, simple, okay. Then there are words like central, okay. Let me write another word, that is central. Central means towards the center of the body. Then the word is peripheral, that is away from the center of the body. Then you have something known as external, okay. External means close to the surface of the body, towards the skin. Then internal. Internal is close to the center of the body. Then there is a word ipsilateral. I am writing all the important terms which you will ever hear in your entire first year of anatomy. Trying my level best to cover all of them in one class. Okay. Ipsilateral is on the same side of the body. Then contralateral. Contralateral. Contralateral is on the opposite side of the body, okay. Then you have the other words like the invagination, as you can see in this image, invagination, inwards or inside or protrusion, inside, okay. Then evagination, coming outside, something coming outwards or outside protrusion, okay, that is evagination. Interior and exterior is same, internal and external, okay, what we just discussed, okay. Then talking about the limbs, the same words which we discussed in the previous, the names you heard, that was the proximal and distal. So proximal, these are something which you will hear multiple times. Proximal is near the trunk or close to the root of the limb. Suppose this is the limb, so this is the root of the limb, okay, the starting point of this upper limb. So proximal would be close to this part and distal would be close to the away from the trunk, or I can say away from the root of the limb, okay. So that is a distal. So I would say my wrist joint is distal to the shoulder joint and the elbow joint is proximal to the wrist joint, okay. So this is a relation, basically you can say, okay. So I hope you understand the proximal and distal. Distal is away from the trunk, proximal is near the trunk, okay. Then there is a word that is palmar. Palmar, okay, this is the towards the palm of the hand. Then dorsal, that is towards the dorsum of the hand or the foot. Dorsum of hand, dorsum of foot, okay. You will see the words dorsum of tongue, dorsum of penis. So these all are the words which you will hear region wise, okay. Then ulnar, okay. Then there is a word that is ulnar, that is the medial border. Why medial? Because you will study in the upper limb, there are two bones in this forearm region, okay. You will read there is a bone which is the lateral bone, that is the radius, the medial bone, that is the ulna. So medial bone is ulna, towards the ulnar side, inner border of the forearm. Inner, why? Because again anatomical position mein rakhoge, so you will find this inner side, okay. So that will be the outer side, towards the thumb side. So this would become the ulnar side and this would become the radial side or the outer border of the forearm, okay. So and then there are tibial, similarly the same terms for the limbs, lower limbs, that is the tibial. In the lower limb the word would become tibial, and similarly fibular, okay. Two bones in the legs, that is the tibia towards the medial side and fibula is towards the lateral side, okay. So that would be the lateral side of the leg. Then there is flexor surface and extensor surface. Flexor would be the front of the upper limb, and opposite for the lower limb, the back of the lower limb. Okay, so that difference you will get to know eventually, but remember for the upper limb, flexor surface, if I write here, the flexor surface that is the front of the upper limb and back of the lower limb. Okay, similarly you have the extensor surface that has the back of upper limb and the front of lower limb. Okay, the front of lower limb. So that is something which you should be knowing regarding the flexor and the extensor. Let me just put it on one place. Okay, flexor and extensor. Okay, so I hope you understood these terms. Then you have something known as the plantar surface. Plantar surface. Okay, plantar surface is towards the sole of the foot. Towards the sole of the foot. Okay, simple. Then we come on to the next, that is the anatomical terms related to the embryonic descriptions. Okay, so these classically you will heard in you will hear in the embryo. For embryonic descriptions. Okay, so number one, that is the ventral. Ventral, now you know, towards the belly, as you can see in this image. Dorsal, towards the back. Cranial, or also known as rostral, that is towards the head. Again, this is asked in the Viva also. And caudal, towards the tail end of the embryo. Then there is some word known as the pre-axial and post-axial border. Okay, so let me write. There is something known as pre-axial border. Okay, pre-axial border that has the outer border of the upper limb, that is outer border of upper limb and inner border of lower limb. In detail why it is there, that you will understand in the embryo part, we will discuss eventually. Okay, but right now just remember why it is pre and post. What is the pre and the post axial border? So post axial would become the inner border, opposite हो जाएगा ना, inner border of upper limb. Okay, and the outer border of lower limb. Okay, so during embryonic development, what happens? Why this is everything happening so in this manner? Just let me tell you one simple point here. Rest we will discuss in embryo. The during embryonic development, what happens? The limbs, they are rotating to the opposite to each other. Okay, so what happens? The upper limb, they rotate. Now I can use the word medially. Okay, and the lower limb, they rotate the in the lateral manner. Okay, they rotate laterally. Okay, so upper limb they rotate medially and lower limb they rotate laterally. Okay, so that's the reason why this pre and post axial borders, they are opposite. Okay, so don't worry too much if you are getting difficulty in understanding this, because this will be repeated eventually. Okay, in more detail. So right now just stick to the simple words. What are the words and what they mean? Simple. Okay, next we come on to the terms for various muscles. Now there is a word which you will this will become a nightmare for you, because many muscles in the body, you have to remember the origins and insertions of so many muscles in the body. Okay, so origin and insertion. So origin is relatively fixed end of the muscle. Let me show you this in 3D so that you will get a better orientation. Removing all the other systems, muscles. Okay, so I take any example. Let me just take this famous one which you might have used multiple times. Gym, in if you go into gym, this is the biceps, डोले शोले. Okay, biceps break किया है, मेरे नहीं है, ठीक है, but biceps break किया है. So this is the muscle which is, you can see here, if I just isolate this muscle, you can see very beautifully around various bones which you will read about in detail. So there is one part of the muscle which is the origin. It is relatively fixed end of the muscle, and then there is another part of the muscle which is attached to another bone, as you can see here. This is relatively movable end of the muscle. So if I just do one thing, and if I just give a motion and I do the elbow flexion, let me show you this movement in action. Just see, this is how the muscle is moving, obviously along with other muscles. So can you see and appreciate, there is one end which is fixed and another end which is contracting and moving. So that is the insertion. So please note that origin and insertion, they are relative terms. If insertion end of the muscle is fixed, that can also be happening, we will study in detail. Then origin end of the muscle moves. So that definition that origin is fixed and insertion is movable part, that is not true now. After so much research, so many years, now we do not use these words. Now the better word to be used is attachments, but still, as your anatomy textbooks, you will find everywhere origin insertion, okay, because it is going on since many years now, and it's not wrong to say that. So let us talk about another thing here. So I hope you got a gist what I will be dealing with. In this manner, we will discussing all the muscles of the body, okay, region wise. Then, so you have understood this. Then you have another term, that is a tendon. Now, what is a tendon? It is a fibrous, non-contractile. I have written these things in this slide so that you remember, because these are some technical words you need to remember. It's a fibrous, non-contractile, cord, rope-like end of the muscle. You will get to see a lot of places where the tendon is seen. I just showed you biceps brachii. There's a tendon also above, which you saw. Then there is a fleshy belly part, the brownish muscle which you saw. That is a fleshy and the contractile part, which is getting the contraction done. Non-contractile tendon is not getting contracted. Okay. Then there is term known as aponeurosis. It is the flattened tendon. Okay, again various places aponeurosis we will talk about in detail. Then there is something known as raphe. That is a stretchable fibrous band made up of interdigitating muscle fibers in this manner. So the fibers are interdigitating, muscle fibers only. Then there is something known as ligament, which is again a fibrous inelastic band connecting the bones. So bone to bone, that is ligament. Okay, bone to muscle, that is tendon. Okay, so that is the difference between the two, which you can remember. Another thing which you will be hearing in detail, we will talk about in the muscular system. There are something known as prime movers, which are the group of muscles which initiate and maintain that particular movement. Okay, I will talk to you about these different types with examples, images in the muscular system. Okay, but just a orientation here. Antagonists, which oppose the action of the prime movers. Synergists, which are assisting the action of the prime movers. Okay, synergistics, or I can say stabilizers, which are stabilizing the movement. Then you have the fixators, which are contracting simultaneously and isometrically to fix the bone and facilitate the action of the prime movers again. So that is fixator. We will talk about it in detail later. Next we come on to the terms related to the movements. Okay, so what are these? Anatomical terms related to movements. Okay, So what are these movements? Number one is the flexion. Now flexion is one thing which approximates the flexor surfaces. Now I hope I can use the word flexor and extensor surface. Now you know flexor surface for upper limb, flexor surface, extensor surface. Okay, so this is the flexor surface of this part. Okay, extensor surface is this one. So if I talk about the movement that is flexion, that would mean the approximation of the flexor surfaces of the adjoining body parts to reduce the joint angle. So if I do this, this is known as the elbow joint, elbow flexion. Okay, elbow flexion. Now this classically takes place along the in the sagittal plane around the transverse axis. So there are some axes and planes of each movements which will be taught to you eventually. For example, this movement, that is a flexion at the elbow joint, which you can see here. Another movement is the extension. So that is extending the elbow, that would approximate the extensor surfaces by adjoining the body parts to increase the joint angle. This joint angle would increase. Okay, so that is again extension at the elbow joint, best example. Then there is something known as abduction. Okay, abduction. Now abduction is the movement of the limb which you can see here. It is moving. This is the normal anatomical position which you can see here. Okay, so it is, sorry, this one which you can see here. So this is the adduction which has happened here. Okay, that is close to the trunk, and this is abduction away from the trunk. So if I am moving this movement, having this movement as shoulder joint, so just see, if I do this movement of this closing towards the trunk, that is the adduction, ADD. Abduction, I am moving away from the trunk. Okay, so there will be different muscles responsible for these movements which will be taught to you again. So this is abduction, movement of the limb away from the midline in the coronal plane. Okay, that is abduction. Adduction is movement of the limb towards the midline of the body in the coronal plane. Okay, again example at the shoulder joint. Then you have something movements which are related to rotations, medial rotation and lateral rotation. So it is a movement, rotation kaise hoga? It's a movement of the body part along the long or the vertical axis. This can be medial or lateral rotation. Okay, so the flexion and extension, that is along the transverse axis which I just told you, along the transverse axis. Okay, then abduction, adduction, that is in the coronal plane. Okay, so these are two things in the coronal plane. Okay, then medial rotation, lateral rotation. These rotations are happening, maybe medial rotation or lateral rotation. So these are happening along the long or the vertical axis. Okay, along the long or vertical axis. Okay, so that is the medial rotation and lateral rotation. Okay, so inward rotation to make the anterior surface of the part to face medially, and lateral rotation would be outward rotation to make the anterior surface of the body part to face medially. Okay, so laterally, sorry. Okay, so that would be the medial and the lateral rotations. Then you have a term that is known as circumduction. That is the most easy one. That is the circular cone shaped movement of the body part with the combination of flexion, extension, abduction, adduction. So you can write circumduction is combination of flexion, extension, adduction, and abduction. Okay. So the joint which forms the apex of the cone, okay, which you can see here in this image, like a cone around which the movements are happening. So this circumduction is not possible on all joints. It is only possible in the multi-axial or biaxial joints. The type of joints we will read later in detail. Occurs in multi-axial joints, multi-axial or biaxial joints. Okay. So classical example, circumduction of the shoulder joint, hip joint. Okay. Then circumduction of the wrist joint, ankle joint. Circumduction of the shoulder joint is helpful for bowling in cricket, which you know. Okay. So that is the circumduction. Another action, that is the lateral flexion. So terms related to the movements, we are continuing that only. So there is the word, that is the gliding movements. Gliding movements. Okay. So that would be movement of the relatively flat surfaces against each other in multiple directions without significant angular or rotational movement. For example, the movements of the intercarpal joints. Angular movements change the angle of the joints. This includes the flexion, extension, adduction, abduction, lateral flexion of the trunk. Okay. Then opposition of the thumb, which will be taught to you in detail. Opposition. We will read about that in upper limb, the opposition. Okay. So oppose, we will just moving the opponent's pollicis. So there are muscles like opponent's pollicis. So it's the movement in which the tip of the thumb touches any of the fingers. Okay. So this you can use any picking movement. So that is important. The lateral flexion is the movement of the trunk sideways. Okay. So suppose if there is a neck movement, you can just do flexion, you can do extension, and you can do lateral flexion. Okay. On the right side and left side. So this is lateral flexion, which is shown in this image. Okay. Another point. So this is the movement of the trunk. Similar, the trunk also you can move in this manner: flexion, extension, and lateral flexion. Okay. Trunky movements. So that is sideways. Okay. So right or left. Then there is something word which is known as elevation. Okay. Elevation. That would be movement which lifts the body part upwards. For a very classical example, elevation, that is mandible. This is the mandible bone, which is to close the mouth. So when I am closing the mouth, so I am moving the mandible up. So that is the muscles which are responsible for this, which we will read eventually in the head and neck region. Then there is the word, that is supination. Supination is supination and pronation. Okay, you will read about these movements. These are all separate things. Supination, pronation are useful for picking up food from the plate and putting in the mouth. So, picking the food and putting in the mouth. Then you have the movements like inversion, eversion. So that is of the foot, which help in the walking on uneven surfaces. Okay, you can see in this image eversion and inversion. The movements of the thumb, they occur in perpendicular plane than the other fingers. Okay, so you can see the pronation and supination here. So supination, pronation, supination, pronation. Okay, so the beggars, they supinate and the kings they pronate. Okay, so that is the dictum which is seen in the textbooks you will read. So you can just remember in that way, no? Someone is giving something, someone is giving something, and someone is asking for something. Okay, so that is the supination pronation, supination pronation, supination pronation. And there are so many disorders where you cannot do these movements, so that way you will understand about the lesions also related in the neuroanatomy. Then, so these are the terminologies which you will hear. Okay, these are the things like the adduction, abduction. Okay, similarly adduction, abduction. So now this, in case of the hands and the foot, you can see there is a difference in the adduction and abduction. Okay, and there is another movement which I have not mentioned, that is a hyperextension. That would be extension of the body part beyond its normal anatomical position. For example, if you have undergone any dental procedure, you might have seen they hyperextend your neck. Okay, and they, so that they can do the things inside the mouth. Okay, so that is another thing. Then you can see here the adduction, that is, if this is my hand, so adduction means fingers are coming close to the midline, and abduction means moving away from the midline. Similar in the foot. Okay, so the thing is that here there is an axis. Just have a look again. When I am moving the other fingers in close, so one finger is not moving, that is the third digit, the middle finger, that is not moving anywhere. So that is acting as an axis of the movement. Okay, so you can see this is the axis. This is an axis. In case of hand, the axis is third digit. Okay, now welcome to MBBS. We don't use the words middle finger, ring finger and all those. We are using the word digits, first digit, second digit, third digit. That is a better terminology. Okay, you should be aware of this. And here the foot axis is different. The axis for the movement, that is the second digit. Okay, the long axis of the second digit. So this is a slight difference between the movements. Then there are other terminologies like other terms like the depression. Okay, like we discussed now, elevation. I talked about elevation, elevation of the mandible, classical example. Then similarly you have the movement, that is the depression. That is the movement opening the mouth, to depress the mandible to open the mouth, movement to lower down the body part. Similarly you have protraction, protraction or protrusion. It is a forward movement. Again, mandible की movement, protrusion, protraction of the shoulder. Okay, protraction of the shoulder, आगे ले आओ shoulder को, so that is protraction of the movement of the arm also, of the shoulder also, of the jaw. Classical examples. Retraction, that is behind. Okay, retraction, retraction of the scapula or retraction of the jaw. Okay, so once you are protruding, you are retracting, so retraction of the jaw or the mandible. Okay, so that is also limited by certain ligaments which you will read later on. So these are some things related to the movements. Now we talk about other terminologies like the anatomical terms related to the vessels. Okay, what are those? The arteries, which carry the blood away from the heart. The veins, which carry the blood towards the heart. Then there is venae committantes. Okay, veins accompanying the artery. Then capillary, that is small microscopic vessels which form the network. Then anastomosis, that is communication between the adjacent vessels. Sinusoids, that is thin walled vessels with large gaps in the wall. Okay, So that is regarding the vessels. Then there are terminologies for the nerves. Okay, what are those? The nerve itself, that is the structure, cord like structure which consists of bundles of nerve fibers. Then there is plexus, that is network of nerves. Okay, ganglion, the group of neuronal cell bodies outside the central nervous system. Okay, there may be sympathetic ganglion, there may be parasympathetic ganglion, which you will read about in detail later on. Then we have terminologies for the bones. Okay, so let us write them separately. For the bones, and this will be very useful for you in the upcoming classes. You will hear these words very often. One is the line. Line is simply the linear elevation, less prominent ridge like the superior nuchal line, inferior nuchal line, temporal line you will read about. Crest, that is sharp ridge or border. Example, iliac crest. Ridge, classical linear raised border, that is example supracondylar ridge of humerus. Then tubercles, slight rounded elevations, example greater or lesser tubercles of the humerus. Then tuberosity, prominent rounded elevation or projections, example ischial tuberosity. Then trochanters, these are very large projections of the bones, example greater trochanter of femur. Then spine, these are long thin projections. Okay, long thin projections, example spines of the vertebrae. Then styloid process, styloid process, that is sharp pointed bony projection. The list is quite long. Okay, be patient. Styloid process. Then the head. What is head? Head is rounded articular end of the bone, example head of humerus. Okay, condyles, that is rounded knuckle like projections, like example condyles of femur. Then epicondyles, that is rough prominence above the condyle, example epicondyles of humerus. Then facets, small flat area for articulation, for example facet on the vertebrae for the ribs. Okay, then grooves or sulci, these are linear depressed areas, that is example radial groove of humerus. Then fossa, larger hollow depressed areas, example radial fossa of the humerus. Foramen, hole in the bone for the passage of the nerves and vessels, example foramen ovale of the skull. Okay, then canal or meatus, canal or meatus. Let me just shift it. Wait. ठीक है. So we have canal or meatus. Okay, so that is tubular passage in the bone. Example, carotid canal of the skull. Okay, fissures, that is gap between the adjacent bones. Example, superiorbital fissure. Sinus, example, the air, like the maxillary sinus, frontal air sinus. All these are air filled cavities within the skull bones. Okay, so these are the anatomical terms related to the bones. Then I talk to you about the terms used in clinical anatomy now. Okay, so now we are dealing with clinical anatomy, which is my favorite. Okay, I will be talking about various clinical things related to the anatomy. So number one, the suffixes. Okay, so what are those? So you might be hearing the word itis. Itis. Okay, so that means inflammation. Example, tonsillitis, inflammation of tonsils. Appendicitis, arthritis. Then ectomy. Ectomy means removal from the body. Classical example, appendicectomy, removal of the appendix. Tonsillectomy, removal of the tonsils. Cholecystectomy, removal of the gallbladder. Otomy. Otomy means to open and close the hollow organ. To open and close the hollow organ or region. Example, laparotomy, opening and closing the abdominal cavity. Hysterotomy, opening and closing the uterus in case when you are doing the cesarean to take out the baby. Then cystostomy. Okay, so these are all different terminologies. Then the word comes here, it reminds me of ostomy. That is to open the hollow organ, to open and leave it open. Okay, to open the hollow organ and leave it open, basically to leave it open. Okay, so classical example, cystostomy, creating an opening in the urinary bladder when the patient is not able to pass urine. Colostomy, creating an opening in the colon. Tracheostomy, creating opening in the trachea. Okay, then you have the word oma, that is means a tumor. Classical, like the lipoma, tumor of the adipose cells. Osteoma, tumor of the bone. Hemangioma, tumor of the blood vessels. Okay, so all these words. So these are the basic suffixes which you should be knowing. Then I talk to you about other terms in the clinical anatomy. What are those terminologies? Let us break them down. We have a good number of list in our mind. Okay, so the various clinical terms which you will hear. Number one, that is the symptoms. Subjective complaints of the patient about the suffering or the disease. Signs, objective, physical findings of the physician who is observing or examining the patient. Diagnosis, that is identification or determination of a disease, or you can say the cause of disease, nature of disease, clinical condition. Okay, then prognosis. Prognosis is forecasting the probable course or outcome of the disease. Therapy, that is mode of treatment. pyrexia, that is fever. Paralysis, that is loss of voluntary movements of the body parts. Hemiplegia, spellings just see for everything, it should not be wrong in your answers. Hemiplegia, paralysis of half of the body. Paraplegia, that is paralysis of both the lower limbs. Then monoplegia, that is paralysis of any one limb. Quadriplegia, that is paralysis of all the four limbs. Anesthesia, loss of sensations. Analgesia, that is loss of pain sensations. Coma, loss of consciousness from which person cannot be aroused. Lesion, abnormal or damaged area of the body. Inflammation, that is local reaction of the body part to injury. It includes swelling, pain, redness, raised temperature, loss of function. All these things we will study in detail in the pathology prof. That will be a separate long chapter of inflammation, where you will read all these signs and symptoms, or all these signs like the swelling, pain, redness, raised temperature, loss of function, which the patient will come to you and you will examine. Edema, that is swelling due to accumulation of excess extracellular fluid. Ulcer, that is discontinuity in the skin or the mucous membrane. Ischemia, ischemia is reduced blood supply to the body part. Necrosis, that is death of the tissue due to irreversible damage to it. Infarction, that is death of the tissue due to the loss of blood supply. Gangrene, that is necrosis with putrefaction by bacteria. Atrophy, that is decreased size of the cells. Hypertrophy, that is increased size of the cells. Hyperplasia, that is increased number and size of the cells, increased number and size of the cells. Then syndrome, that is a disease with group of signs and symptoms together. Tumor, a circumscribed non-inflammatory abnormal growth. Benign, that is mild form of illness or non-spreading tumor. Malignant, that is severe form of disease or spreading tumor. Cancer, malignant tumor. Then metastasis. So tumor and cancer, these are not synonymous words, okay? So tumor is a non-inflammatory circumscribed abnormal growth. Cancer is malignant tumor, okay? This is malignant tumor. Okay, don't confuse. Metastasis, okay, that is spread of disease or cancer from one part to another. Thrombosis, that is intravascular coagulation of blood. Embolism, that is occlusion of the blood vessel by a circulating thrombus. Then hemorrhage, that is abnormal and excessive bleeding. It can occur externally or internally. Then sinus, which is a blind tract which can be open at one end. Fistula, anomalous connection which can happen between the two places. Okay, so you will read, the list is actually endless. Okay, so I can just end here. So in clinical anatomy, it's all the 5 years of MBBS, 5.5 years, and you will read so many things in anatomy related to it in the first year itself. So at least the nomenclature should be clear to you, what are these parts, and that will make you understand the various things. So that's the introduction of anatomy from my side. I hope I have done justice and you have understood some things. Thank you and take care.